spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
What a beautiful day to be alive. My debt is paid and more money arrives. The fridge is full and there's plenty of ice for a fireside chat with anyone I like. What a beautiful day, good to be here, when almost everyone has disappeared. When almost everyone is waiting in line, it's good to meet you in this world of mine.
Welcome, everyone. We are live with Dr. Carolyn Dean here on AchieveRadio.com. Welcome to another great Monday evening. Those who are listening through the podcast or the archives, glad you could be with us as well. We are thrilled to be in episode 2 of our Doctor to Doctor series, where Dr. Dean is working and featuring doctors that she values and thinks highly of, and wants to bring them into more public awareness and also present their skills or talents and what they know about how to work with the human body and also biological things and all kinds of fun stuff to get people up and running and feeling better. And tonight we're so thrilled to have somebody who's near and dear to not only Dr. Dean's heart but also my heart. I personally have worked with Dr. David Holt, and he's going to be joining us here in a minute, and we're going to be able to put people on the line with him and let them talk to him if they are so inclined. I will read some information to you about Dr. Holt so you kind of get an idea of where he's coming from, and kind of, although you never really know where he's coming from, but we'll try. Let's put it that way. And also this evening, we want to make you aware that we're going to have Dr. Holt for the first hour. If you're going to be interested in talking to him, please get in on the phones early. Do not detain or delay, because we've got lots of people who've emailed us about talking with him tonight. We've been announcing his appearance for the last couple weeks. 602-666-6027 is the phone number. And when you get in, you've got to hit *5 on your keypad to let me know that you have a question or comment, and we'll try to get you on the line in the order that the calls come in. Now, let me just again tell you that Dr. Holt did graduate from the Western University of Health Sciences in Pomona, California. He had the completion of 4 years with the U.S. Air Force as a flight surgeon in Vandenberg Air Force Base, California, and he was confirmed as a homeopathic medical doctor in the state of Nevada. And he's got an extraordinary background of experience. Before we bring him on, I just want to say hello to Dr. Dean. How are you doing tonight, and are you excited?
Yes, hello. You must give the children their due. We have to have the children introduce me.
That's right. Well, here we go.
We get so excited about having Dr. Holt on that we forgot that. Yeah, I'm here, but I am absolutely going to take a side seat on this event. Jenny has questions lined up from emails. We have people phoning in. We've been talking about you so much, Dr. Holt, over the years, talking about total biology.
Oh, gosh, isn't that the truth?
Yeah, what we do is we try to work on the physical body, and, of course, there's the emotional aspect. But when our people are doing their diet and their exercise and sleeping good and taking their completement formulas, and they say, well, I still don't feel quite right, and this is happening and that. We say, well, what's the conflict? And I look up my total biology notes. I've got about 1,000 pages of notes that I took from Dr. Gilbert Reynaud, who also was Dr. Holt's teacher, and then his associate. They taught together and practiced together. So I know that the folks who are listening are very, very interested, and I'm fascinated to see how this Q&A will turn out, because sometimes it takes a few sentences and you know what's going on. Sometimes it takes a whole hour, so we'll see what happens. So welcome to the show, Dr. David Holt.
Okay, now we're going to give him the children. Hello.
Okay. Hello there, Ginny and Carolyn. Can you guys hear me all right?
We can.
Yes.
Okay. Well, here I am. All right. I'm ready to go to work.
Okay.
Now,
Ginny,
let's just tell the people I have to tell you, first of all, I have worked with Dr. Holt, and I have a lot in common in our backgrounds, and he's actually living where I used to live. It's just funny, and you get working with him, and you ping, 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 because there's so many great connections. So I don't know his short story. I've only heard the really long story of the intertwining of all the things that we had in common. So Dr. Holt, tell us the short story of how you actually came to be doing what you're doing.
Oh, well, first there was the Big Bang. That was really interesting when that happened. You want the short version, not the telescope. You want the microscope. Okay. Well, gee, boy. Let's see. Well, I was in the Army in a Ranger Battalion back in 1985 to 88, and I sort of got a little bit interested in the medical side of things from the combat medics and going to the course in combat casualty medicine. And at that time I thought, I guess I might be able to do something like this when I get out. But I was heading into engineering, and a few years later I decided to go into pre-med. I was doing some Tai Chi and was feeling, energy running through my body, and I thought, this is interesting. And the engineering, I kind of discovered osteopathy, that there are two types of hold positions in the United States. There's MDs and DOs. At least those are two of the major ones. Anyway, and they approached the body from some kind of intelligence, and it was a hands-on sort of a situation. And so I started steering in that direction, and really kind of my burning fire of interest in the intelligence of the body sort of got sparked with Tai Chi, and then it got fed even more as I would hang out with these old-timey, 10-fingered osteopaths, as they called them, that would just do miraculous things with their fingers, and they would feel things. You'd say, how could you feel a 74-year-old person that fell on their skateboard when they're 12 years old and they still have a problem? How in the heck does that work, So, anyway, I was kind of mystified, but also really interested. So I ended up doing my time in the Air Force, and then got out, and then just began studying a great number of different approaches. Trained a lot with Dietrich Klinghardt, and learning about toxicity and nutrition, the mental, emotional things. I worked at a clinic where pretty much everything was Lyme disease, which was sort of interesting at first, but then after a while, it's like, boy, there's no creativity here. Everybody just has Lyme disease, and I didn't necessarily see everybody healing from their so-called Lyme disease. And so anyway, I ended up going to a cancer clinic and working there, and that's where I encountered the work of Dr. Reiki Hammer and Claude Sabat, where they approach the body as having this real intelligence. And boy, it really threw me for a loop, because they were seriously saying things like, cancer, sure, you got a lung cancer, well, you had a shock, you had a conflict, the body's simply reacting to this conflict shock and doing the best it can to kind of hold things together. And as it turns out, all diseases are a form of that. And I thought, well, that sounds kind of crazy, but I'd like to look into it. And so anyway, the last 12, 14 years, maybe 15 years by now, I've been looking into that. And so it's really interesting. So I just last maybe about 10 years, 9 or 10 years, I kind of have a telemedicine type of practice, a consultancy where I work over the phone. And my two favorite things to do are to connect with people energetically, moving through the body, anatomically with attention and intention to open things up and make connections. And then the other aspect is the total biology, the kind of reframing what the heck is going on with this suffering with a symptom I've got? How can I see it in a different way? How could I change the way I look at things so that the things I look at change? And that's what I do. So those kind of things. So does that bring you up to speed? Is that a short enough version, or was it too long?
No, it was absolutely
that was
perfect.
good.
The only thing that wasn't perfect about it was, let me ask you, are you on a speakerphone?
No, I am not on a speakerphone. I have one of these giant little DJ phones here. The room might be slightly echoey. Are we getting a lot of echo, or does it just sound like I'm in a tunnel, or what?
It sounds like you're in a tunnel. It's a little thin. So
all right. What about?
We will work.
Well,
what about now?
All right, we'll work with it. Just pretend I'm broadcasting from a tunnel. That will make it more exciting.
Okay, very good. Okay, so we talk a lot about total biology on the show, and as you know, we've talked a lot about you as one of the kind of go-to people that people can access to use this kind of technology. Wondering about but I also know that you've done generational things with people, and you've got different kind of modalities. How do you assess what you're going to do? Is it all intuitive, or do you have kind of a strategy?
I think it's a mix of everything. It also depends on the person I'm sitting down with, their constitution, where they're already pointing to. Some people are chomping at the bit. I'm really curious, what's behind this, burning in my ears, what's going on with this thing, and I'm coming to you for that. And other people might come like a little chiropractic adjustment or energetic, like a acupuncture type of a thing. I want to open this. I want to find the blockage in my body that relates to this burning in my ears. So it sort of depends. And some people are like, hey, anything goes. Let's just hit it. Let's go, And so part of it is just being real spontaneous and just noticing what shows up, but also noticing where a person is at. I might feel hunky-dory about, I want to do family constellation therapy today, but they may not be there, so it's got to be, it's a sort of this dynamic, it's a little bit of a dance, it's a living dialogue. So you sort of, when I practice, it's very spontaneous sometimes, but at the same time, if there's laboratory tests or scans to consider and look at and read, I'm on that too. So we mesh the logical, the data, and with the intuitive and with just sensing, and we get it to work together.
Okay, outstanding. Well, I don't know if you've ever done this before. I know you have a phone consultancy. I don't know if you've ever done anything where people call in on the radio and talk to you about their stuff. But we're going to put you on the spot and let you try it and see how it goes, and just kind of have some fun with it, because I would like people to know that this is available to them for sure, because it's such a wonderful dynamic. And Carolyn does it beautifully on her show. I mean, she's helped so many people with this. People will call in, and she's just great about feeling them out intuitively. And then she'll say, I know we're talking about your thyroid, but in total biology, thyroid is related to time speeding up or slowing down. And are you trying to speed up time? Or are you trying to slow it down? And then somebody will just burst out crying and say, my dad's dying of cancer, and I'm afraid I'm going to lose him, and I want it to slow down. I'm afraid. And then just, the release is so incredible.
Yes.
Yeah, so it's really cool. So I think people are going to have fun with you tonight. Okay, so can I put some, first of all, I sent you some emails. We'll get to those, but let's try a phone call and see how it goes. Do you mind?
All right, let's do it.
Okay. So I'm going to go to area code 515. Now, listen, if you've talked to me earlier in the day and you've said you want to call and talk to Dr. Holt tonight, this is the time to call me so you can get in and I can see your waving hand. Again, it's 602-666-6027, and I'm going to put you on the phone with him as the calls come in order. But right now we're going to go out to the great state of Iowa to area code 515. Are you there?
Hello, Jenny.
Hello.
I feel like you and Dr. Dean and Dr. Holt are just my friends down the street. I just have a testimonial, actually.
Okay, well, tell me who I'm talking to, please, and then hello and welcome.
My name's Vanessa Scott, and you guys helped me through a really rough. Tell you my gratefulness of the whole thing. So, hello,
Vanessa, you got cut off. You said we helped you through a really rough, and then it went away. Tell me again.
Oh yes, all you girls and boys helped me through a really rough patch I was going through, and I just wanted to express how grateful I am and how quickly something can turn around with all the resources we have. So I just wanted to put a shout out there that this stuff works. It's great work. It's hard work. But I wish this was taught in all the grade schools, and everybody would be so much happier.
Oh, very
That's
nice.
right,
So, Vanessa, you worked with Dr. Holt, right?
Yeah, we worked together for many sessions, and I hate using this wording, but he got me out of the pits of hell that I didn't think I was capable of. So I just wanted to call in and say that. And I never would have met him had I not gone through the pits of hell, I wouldn't be where I was now. So I just am very grateful to all of you who tell us these resources and tell us, what we can do. There's so much out there that we can do for ourselves, and it's awesome.
Oh, wow. That's so sweet. Dr. Holt, do you have anything you want to say?
Well, Vanessa, without, giving up the ghost or too much, maybe you could share with the audience something, the way you made a connection or some kind of a connection, or, what was, in your experience, what was the key thing? What was the, you don't have to go into specifics, but I don't know, share something of your living experience of that turnaround that you're talking of and how it came about.
Well, I do want to put out there that, too, there's so much information for all of us that if you read something on the internet and you get into energy work, let's say, and you might get into a little bit of a sticky situation with that energy work, we don't live in a village where there's the shaman down the street that can take us in for a year when we hit that spot that's, I don't know what to do about this. So, number one, he is so available to anybody at timing that regular people aren't around. And so that was great. And then just to have somebody to bounce everything off of and get validation of what you're feeling. Yeah, you're not crazy. Maybe this is just your spiritual patch that you need to go through to get to that next level, and changing of perception. And I don't even know where to begin. I could go on and on.
Okay, well, thank you so much for the vote of confidence there, Vanessa. And it's, as one of my favorite healers, an old-timey osteopath, used to say, thank you so much for giving me the pleasure of watching you heal yourself.
Oh, wow.
Yeah, it was great. I don't want to take up too much time because I know other people have questions, and I just wanted to give big love to all three of you, and it's just amazing. So thanks for everything, guys.
Oh,
Thank you,
so
Vanessa.
welcome. Thanks for calling in, sweetheart. All right, very good. Oh, that's so sweet. Oh, look at that. I thought your calls were going to be hard, and they're easy.
Oh, boy. Okay, batter up. I knocked that one out of the park. Okay, next.
That was good. Okay, let's go to area code 619 out in San Diego, California. Go ahead, please. Give us your name and then state your question or comment for Dr. Holt.
Yes, this is Doug in San Diego.
Go ahead, Doug.
Yes, Doug.
Can you guys hear me? Hi. Yes, Doctor. Dr. Dean had asked me to call in from last week's show about a total body biology question. And so I had a significant back injury when I was a teenager. I had started driving, so I don't know what, I guess it's teenager. But it has caused me trouble ever since. And I attempted to find out the vertebrae yesterday with an MRI, but I freaked out and had to stop the MRI. So I don't have the exact vertebrae. But it was trauma from a family member done under anger, process the emotions. And as I'm starting to seek medical treatment now, I'm much older. I'm now 55. I wondered what do the vertebrae in the mid back that are attached to the bottom ribs represent in total body biology, and how should I move forward with this?
Well, it's interesting. You know, you're asking for the pull out the microscope and give the definition, but sometimes, you know, you can be pretty general too. You don't necessarily have to, and I don't even have a book in front of me, and I often don't, and it's all right. It's okay. You want to keep things simple, you know, keep it simple, right? So keep things simple. In that, now there is this be specific too, and that's what you're pointing at, specificity. But I would just say this, you know, one of my favorite sayings is, I'm sick today because I didn't finish something yesterday. So the yesterday could be, you know, 10 years ago, 30 years ago. It could be some grandparent. Anyway, the point is, look at when that injury happened, that accident happened, and is there usually, by the way, if Carolyn hasn't already shared, you know, we don't have accidents out of the blue. I don't recommend telling people that immediately after they've had an accident. Shut up, you're going to get an accident on your job. But anyway, we don't have accidents out of the blue. Generally, they happen after we're sort of popping out of the stress. So to examine the underlying stress leading up to that accident, and also you might say, boy, it's so long ago, I don't know. And, well, you could dig into there a little bit, maybe journal it a little bit. But also, you can also look at whatever kind of a dysfunction you do have in your body, you know, because all disease does is one or two things. It either opens a function too much or it closes it too much. So in what way is your life affected by this, say, suffering or the symptom, you know, in a thoracic vertebra or whatnot? And then to look at that, how does it make me feel that it's there? Let's say it makes me feel angry. Okay, to begin looking at that, and there's going to be earlier episodes and maybe around the time of the initial accident of anger. It could have even been, you know, the accident itself locked you into the trauma because of what happened in the midst of, say, an emergency response or getting out and yelling at the other person. That can sort of glue or cement. So, I mean, what I generally do is I kind of sort of like...
Hello?
Uh-oh, Dr. Holt, we lost you. We lost you for a second there. So you said, so what I kind of do is...
Well, what I do is it's like a ping pong. It's kind of going back and forth now. So I put the ball in your court, Doug. How do you relate to what I said? What resonates with you? You know, I'm sick today because I didn't finish something. Yeah.
Well, it's caused significant physical trouble throughout my life, and I've addressed it with chiropractors and had some relief. It was the first time I took a deep breath in 10 years was a drop table chiropractic adjustment, you know, with the chiropractor's palm underneath that part of the back, and then he dropped the vertebrae back into place, and I took a deep breath. I went all through boot camp with that vertebrae out. And here I am 55, and now I'm getting spinal curvature is what the back doctor said over here with Kaiser. And she ordered the MRI, which I could not finish without being medicated or getting another machine, you know, a larger machine to be in, because I started to panic. That was supposed to happen last night. So I couldn't address the specific vertebrae, you know, I didn't know exactly which ones. But what happened was, for me, that I didn't say earlier, when I first met the back doctor and told her about the trauma from my father, you know, I was physically attacked and punched in the ribs, and all that happened in a very short amount of time. was that in the talk with the doctor, and I've discussed this even in therapy before when I was younger, I never cried about this, but I almost did that day. So and I don't walk around angry all the time, but that might come up later. I know about working on inner child and feelings. That's not a problem. But I wanted to call in and get also the intuitive side, what was picked up by hearing me, on the line. I was asked to call in, and so that's what I'm doing. I waited a whole week. I'm kind of excited about this now and moving forward with my body and Dr. Dean and your advice, because I trust Dr. Dean beyond belief. So that's where I'm at, and I'm ready to do what needs to be done so that I don't suffer consequences from this injury physically. I'm willing to work on the whole person, so that's why I called into the show.
Yes. So now my job is to pick out little pieces that are the key pieces. So when it was impressive to hear stories of mechanical interventions, but that's good. But what you're in need of is an informational intervention. The information, the way it flows. For example, when you were going to get inside of the MRI machine, right? Mm-hmm. Something happened there. That didn't happen out of the blue. Your system was already dialed in to be, in a sense, allergic or sensitive at a mental, emotional level to respond in the way it did. And when you described for me my dead drop table chiropractic, I was able to breathe. Well, you gave me an important aspect of your condition, which is it affects respiration. Father punch to the ribs, okay? The ribs, okay? Think about the lungs and respiration there. And then you feel kind of speedy to me right now. I'm chopping at the bit. Let's go, guys. Okay, what do I got to do? Well,
I had to run out. I had to run out of a very crowded building to take the call, and it had to be very fast because I didn't know I was going on the air.
Sure. So it's all synchronicity. It's all getting presented perfectly. So there's this panicky thing. There's this breathing thing. There's this getting punched by the father. So, for example, think about what I just said. I'm sick today because I didn't finish something yesterday. So if that were true, what would be the thing, what would be the experience you had that is not finished? It's not complete. What would it be?
Well, I'm not there yet to understand that. I can't just answer that because I don't really understand the question. I understand there's probably something that you're asking me to address that I probably can't see yet.
Well, that's true. That's a good point because we all have blind spots. Let's take somebody that's got a post-traumatic stress disorder, say from a combat experience, say they were walking along in Afghanistan or driving in a vehicle, for example. So those vehicles can be pretty close. Maybe they were eating a ham sandwich and with mustard on it, and a bomb blew up. So at that time, there was a shocking event that happened. And so what happens is the body-mind records all nuances in the environment. So the mustard, the smell of the mustard, ham, because I'm in the process of taking a ham sandwich in and assimilating it and excreting it. So while I'm in the midst of that process, I get a shock, okay? Now let's just say that happened and I survived, and it's 10 years later, it could be 30 years later, and I come in complaining of maybe I've got joint pain or maybe I've got reflux, heartburn or something. Let's say somebody does some food allergy testing. They find out, boy, you're really allergic to mustard and also ham, okay? And so you can approach this from a couple different perspectives. One, if I was, say, an allergy person, I might say, hey, I do allergy elimination. Guess what? I've got a couple little tubes here. They've got ham and mustard in them. And we're going to do a little reprogramming. Hold on to these little tubes, and we'll do, there's 100 different ways. Doesn't really matter. But we could just massage down your spine, something soothing to give you a window to reset your relationship to the ham and mustard. Or I might say, hey, I wonder if you have any traumas in your life. I wonder if you've experienced any shocks or traumas, and I wonder if you've gone through them, and like the book that somebody wrote, Feelings Buried Alive Never Die, I wonder if you've got some feelings buried alive that never died, that the chiropractor wasn't able to manipulate out of your system. And how do you know? Do you do a laboratory test? Not really. It's pretty simple, actually. You go back in time and you close your eyes, maybe, and you start talking about the trauma or the experience. And when you do, we'll know if you're done with it, because there won't be any charge. You won't feel any panicky feelings or short of breath or, any feeling of alarm. There won't be any charge at all. If there is a charge, it's evidence that you have not completed that experience, which is pretty common, by the way, to have a shock or trauma. And although you pass through it in time, you're not done with it. So there's likely some aspect of your condition that it keeps feeding back from the past. The past keeps screwing up your future trajectory of a straight spine or a spine that is pain-free. And so one method to make that stop, which is what you want, is for it to stop, is to begin looking into it and change the way you're looking at it, reveal something. Carl Jung, there was Sigmund Freud and Carl Jung, and one of my favorite quotes from Carl Jung was something to the effect of, that which arises from the subconscious mind into the light of conscious awareness does not return as fate. In other words, we have these blind spots. There's something you do not see. You have not recollected it. You have not finished it. You have not brought it to completion. And so it's like the proverbial scratch in the record, and it's going around and around and around, and you try a little manipulation, you get a little bit of relief, and you try a little supplement, you get a little bit of relief. But the way the information is flowing in the nervous system, it's being run by these old traumas, most likely. Mm-hmm.
So you're asking me to
make sense?
Well, I guess you've gone over a lot, but I'm trying to address it specifically to my event. Are you recommending that I bond with the actual trauma and process the emotions? Is that what you're saying?
Am I recommending that you finish any unfinished experiences so that you can be free to live in the moment and have your trajectory not get screwed up by a past event? Yes.
Well, that I was pretty familiar with. As far as the rest of this stuff, they weren't directly related. I took it all in. I'll re-listen to the broadcast, because there was emotions there. I come from dysfunction. I'm very aware of that. There's things that are blocked from very, very young that I won't always be able to see. That might have been part of this too. But this was blunt trauma to the physical body during an attack, and I never processed the emotions of it. They're starting to come up.
That's right.
They're starting to come up, and I can do that during meditation and prayer alone. And journal. I know how to do the inner child writing. I know how to do regression. I've actually had an age regression where childhood abuse came up, and I had body pain during that journaling. There was like 5 different ages that came out of me. That happened very early on during my therapy, which I'm no longer with that therapist. It was very, very prosperous work, but it did end. And I possibly, if that's what needs to happen again, I don't have any problem with that. I just needed something to bounce off of, since you're doing total body biology today, and that it's funny that I was going through this the week of the call, so I was encouraged definitely to call in. So,
Let me jump in here, Doug, and address you and Dr. Holt. Now, it's obvious that a child or a young teen who gets physically brutalized by their father that has layers and layers and layers of emotion. A father who's supposed to protect you attacks you.
That's just one event.
And that's just one event. I mean, how does a human being process that? And I know in total biology, what I like about it better than German new medicine is that the naturopaths got a hold of total biology, and we work with the Bach flower remedies. We work with amazing affirmations and do all that.
Sure,
but,
the full process,
Yeah, but I know Dr. Holt as well. He does a Tongren, Tongren, tapping on the body to help release emotion. It's what acupuncture or acupressure does, and we're not going to be able to do it today. But Dr. Holt would take like a plastic model of the body and tap on the spine of that. Model.
I've seen them. I've seen them hold that up. Yeah.
Right. And
I'm aware of that. I'll look into that.
Right. But Dr. Holt, I know you hear from people who've had these horrible traumas. Take over for me from here.
Well, I always liked how Gilbert would remind me. I'd say, I went into like 10 traumas and we cleared them, and they still have 40% of their illness. He goes, great, you found 40% of the conflict, or 60%. So keep working. It's kind of like that game Tetris, where you're lining up these things, point, 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 and then you get the. So I hear, quite a bit of people, I've done it for 35 years. I've done the emotional stuff. Well, okay, maybe we need another 20 years, or maybe it's going to be 1 week. Who knows? But you still got the conflict. The conflict's still running. If you've got a biological problem, most likely, with the exception of, my arm's amputated, I'm trying to grow it back. Okay, maybe that's limited by the biology. But assuming a person's capable, the body's capable of healing a problem, then it doesn't matter how much therapy they've done. The subconscious mind is still feeding information into the autonomics. So if you're only, 60% better, it doesn't matter how much you've tried all this and that. You still have blind spots. And so it's, does a person want to continue working it? And if they do, then most important thing for me, actually, I tell people is it always comes back to law of attraction. Get into vibrational alignment with that, what you're asking for, and things will just start happening. You'll get a curiosity. You'll be like, boy, I always wanted to try hypnosis. And you find somebody across the street, or it'll be something else. But just find yourself in that space where you're getting vibrationally aligned. You feel, man, I can feel that healing. I feel healthy, feeling into that, and then the healing's going to find you. I tell people, don't look so much. Don't be eager to go find the healing. Let it find you. You just shift your vibration, then go out and you go meet people and knock on some doors, read some books, and it'll find you. Let it find you. Don't be so eager for your healing. You get so eager, then really underneath that eagerness is a fear, well, gosh, I've been going this long. How much longer is it going to be? And then you get tangled up in this law of attraction of attracting. It takes too long to heal, and so you get more of that. Does that make sense?
Yes, and I'm understanding that both of the doctors today have said, be aware of the blind spots and don't hesitate to look there. That doesn't mean, be endlessly, trying to search, but be open to that and let it expose itself to me by just living my daily life. But being physically and mentally and spiritually open and emotionally open, not to say no to something which could give me some insight to the blind spots.
Right. And keep up with the chemical body, the biology, the fact that you had the anxiety, that's a body reaction as well as an emotional reaction, the claustrophobia. But keep taking your magnesium so that your body's strong enough to be able to face the conflict.
Yes.
That's what it seems to involve, is to acknowledge the conflict, know that it was mostly your father's story, and he puts his story onto your body, and then you've carried it, and you have to give it back to him.
Multiple family. Yeah, it's like you said, multi-generational stuff. Then I will just start my journaling again.
Mm-hmm.
When things, and I'm always open to processing. It's never a problem for me to process something if it comes forward, like you said. Let it approach you. Don't block things.
Consider the possibility that I'm going to get this scan. Man, I'm chomping at the bit because I want the specifics. Let's lock it in down to the vertebra. And then you get something even better. You get a diagnostic chunk of information even better. So wouldn't it be funny? That's exactly the information you're looking for. I go into this thing and it's like closing in on me. Think about the rib cage, I'm going into it's closing in. I panic. I completely lose it. I can't breathe, whatever. That was the chunk. That was what you wanted. That was it.
Well, to answer that and to keep it brief as well, I'm going to take an anti-anxiety medicine, which is common with MRIs. Like 90% of the patients have trouble getting in those machines. So, or get an open bore designed machine. I'll leave Kaiser and go outside and get it done, just so I have a picture and the doctor can look at it. The diagnostic side, like you said. I'm being open. I didn't take anything, and most patients take a Xanax or a Valium or something, and I didn't take anything. I thought I was okay until, I'm buried in this machine, and just before he hit the switch, both times I said, yank me out. I said, I'm out. I don't need to see it right now.
That's your diagnosis right there. For me, that's all. I'd be all over that. That's the key right there. That's the
to go get the testing to see it exactly. Now the emotional side, I'll let it come up and I'll let it evolve. But I'm going to do the tapping because I'm aware of that.
Yeah, the emotions they're biological. Don't downplay emotional. That's biological. Everything's biological.
Oh, absolutely.
Mental,
absolutely. Everything's connected.
Mechanical. It's all biological. Okay, well, thanks, Doug, for calling in.
Thank you. I don't know how to hang up on the call, though.
I do.
And go, okay. Thank you, Dr. Dean. Dr. Dean, I'm a lifer with the products. Don't worry about that.
Oh, great, Doug. Thanks for calling in. You're awesome.
Okay, bye-bye.
Thank you.
Thank you.
Bye-bye.
Excellent.
Now,
okay. Go ahead.
Okay, now maybe we should shift gears here because that's a real kind of a time gobbler, and I've got 3 emails here. I think I could be kind of more succinct and what do you guys think? I'm going to go over some of these email requests.
Yeah, for sure.
Sure,
well,
absolutely.
Because the live thing is going to it could really take quite a while. And okay, so I'm looking at the first one. Okay, Lorne. Okay, just to show people how you could incorporate the raw data, but also your intuition. So we could play with that name, Lorne. Here's Lorne. He says he's a 59-year-old fella. He never had any allergies before, but about 2 years ago, he got some allergies, some runny nose and itchy eyes, right? So there was a time when he wasn't sensitized to some substance, whether it's an inhalant that you breathe in, a contactant that you're touching, an ingestant that you're eating. He didn't have these reactions, and then he did. So people out there in the audience, you might think, what would you be thinking? I'd be thinking, I wonder what happened 2 years ago. Must have been there was a split moment in time where there wasn't the reaction, and then there was. So that's a good possibility to research. Now, when I look at the name Lorne, that's all I've got. I don't have a first or last, but you can play with the name, and you guys will think this is silly. But I can play with the letters a little bit, If you unscramble those letters, I can make a word. I can make a word loner. Loner makes me want to ask about that, being alone or someone else. Interesting, because all allergies relate to, separation conflict oftentimes. So also, if you look up the meaning of Lorne Scottish derivation, that it relates to forsaken. If I read my Googling correctly, to be forsaken. So anyway, Lorne, if you're out there listening, yeah, we don't know exactly what it is. You give a history of it's the same all the time. So it makes me kind of downplay seasonal allergies as the substances triggering this. And I wonder about something you're exposed to equally all the time, something you're eating, or maybe it's a home or office or business place exposure. But it's important when we talk about allergies that you're really not allergic to the thing, actually. Even though you can be triggered, it can cause, life-threatening issues and problems. The allergen, whether it's an inhalant that you breathe in, a contactant that you touch, or an ingestant that you eat, what happens is during some time where you were predisposed to a linkage to a programming, as we were discussing about Doug with someone that's had post-traumatic stress with a trauma, that's a time where you can get linked in with an allergen. But what happens is the allergen becomes a substitution for the trauma. It becomes an equivalent. So if for example, I was trying to breathe, say I'm Doug, and I was trying to breathe and my father punched me in the ribs, that could knock my diaphragm functioning out, for the rest of my life, because I was in the process of respiration and breathing. And so as long as that story still has teeth, even if a person's done much therapy on it, if we go dive in it and they start really, getting emotional, well, obviously you don't need a lab test. They're simply not done with that. So we need to finish that either by going over the story repeatedly or looking for an earlier story that's at the heart of that. So anyway, that's Lorne. So I would, I also think of forlorn, to be forlorn. Anyway, Lorne's not here, but okay, we threw that we throw him a little morsel to chew on there, and he might digest it, and he might come up with some resonance there that's going to shift his nervous system. Any comments from you, Jenny or Carolyn, on that case?
It sounds like you squeezed as much as possible out of one little sentence. So it just is evidence of how we should, could, would analyze everything that's around us to give us clues.
Yes. It's interesting. I remember we used to take pictures of the patient's face in a clinic where I worked, and one person came in with severe depression. And sometimes I would just sit there and look at the picture. Just look at the picture, like something's going to pop in that picture. Something they're wearing, an expression on, because it's a holographic universe. And the most striking thing, it was interesting, in total biology, we say that depression and anxiety are controlled from different hemispheres of the brain. So their head was extremely tilted, almost as if one half of their brain was extra weighted. And it turned out to be, that was the side related to the depressions. I think it was the right side. It was tilted like that. And it was just to see that. Somehow I connected with something in a really deep way, just to witness how the world was showing me some random event, a picture, a photograph. It was mirroring, the essence of their case, this depression. Okay, so let's go to the next one here. It's Jean Shermer, and I've seen her before, and she gives a little testimonial, and it's kind of interesting how I had mentioned that, you are not isolated in space. We're all interconnected. And we really are interconnected. I mean, you think of the Big Bang. Boy, imagine how many people were squeezed into the space of a ping pong ball. The planet Earth, 100 billion stars in our galaxy, millions of galaxies all squeezed into a ping pong ball. That's pretty tight, right? So everything's connected. So anytime you reveal something that seemed disconnected to be connected, it's a recapitulation of where you came from, the singular collective oneness. And so anytime you connect things up. So anyway, she had said that when she shifted, one of her nieces really shifted in a relationship. And it's a good thing to remember. As you work on yourself, you help your entire family. Sometimes there are family members that are sort of out of reach or uninterested, but you can sort of work on yourself and you can be an inspiration to them both consciously and subconsciously. But anyway, she's got a little question about a little crook in her neck down near her first rib, thoracic 1 and first rib. Well, generally, just kind of shooting from the hip here, I'd say the neck generally relates to communication. Okay, communication. Just think about talking to a friend or someone, you're nodding your head, yes, or you're shaking your head, no, or you're making a funny sound, your dog looks at you funny, what the heck is that, Okay, so the neck relates, and of course your ideas come from your brain, so your neck is almost like a catapult, like a drill sergeant yelling at a recruit. They really gyrate their head, right? So it relates to communication, and it relates to the intellect. And so she's saying the junction of her neck on the right side, assuming Jean is right-handed. That could be, partner side. So the left side being babies and mommies, and the right side everybody else. So it could be husband or sibling or somebody at work. Okay, so there's the communication, and it joins with the rib cage, the upper aspect of the rib cage. And she said sometimes it goes into her jaw. Now for me, when I'm doing this on somebody, the way my intuition works, I'll feel some things in my body. So we don't have like this living dynamic going on, but usually as I'm speaking and getting feedback, I might feel their jaw light up, or maybe the shoulder lights up. If that right shoulder lights up, that may be more of a identity issue, who am I in my own eyes? Or if it's the jaw that lights up, it might be their relationship to food, mastication or elocution, verbal communication. But anyway, that's a little bit of a smattering without Jean here. I'll kind of leave it at that. Anybody else want to make any comments or insights with that one?
No, that's great. I know Jean, and I know she had very good interaction with you, so I'm glad she wrote in. Thank you, Jean.
Now, Dr. Holt, we only have 3 minutes to the top of the hour, and then we're going to wrap this up. So I know you have another you say good. I know you have another person there who's sent something in, but I'm wondering if you could, would you be willing, you want to say something for a minute and a half, or do you want to respond in an email and I'll get it to the person? Which would you prefer?
I can respond in 90 seconds. This
Very
is
good.
like, when, all right, boy, you're cracking the whip, aren't you? Okay, anyway, so KCH is kind of saying, hey, I've had lots of traumas. Hey, what's the deal? What's the protocol? There is no protocol. What is the protocol to clean up all of these things? And she says EMDR. Well, here's what I'll say. I've taken dozens and dozens of release therapy type of interventions, and let me just present something that makes it really simple. All this tapping, EFT, tapping, EMDR, moving your eyeballs back and forth, humming, skipping a jump rope. All it is simply a distraction. It's simply a distraction. When you make the human being do two things at once, like remember the trauma and do another thing, it basically takes the conscious mind, it preoccupies it, and it can be very effective, because then the subconscious is open to express or to disperse that stress. So it kind of doesn't matter. Somebody could be going blah, 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 like that with their finger, or they could jump a rope. They could whistle Dixie or hum Happy Birthday. It doesn't matter. But there is a magical thing when you distract that conscious mind. You can also do it through hypnosis or relaxation. As long as that conscious mind is not getting in the way of the subconscious mind. So I would say it doesn't matter the modality. What matters is that you find the moment and you go to those moments and you discover if they're finished, and then if they're not, you finish them with whatever method you want to use. But sometimes it's hard to do it with yourself because it's like tickling yourself. Doug had said, well, I could do everything by myself. Well, you might be able to, but I'm telling you, tickling yourself is kind of challenging. So sometimes it's a little challenging to do your own healing work because we've all got our blind spots, and the person you meet might be able to see something you can't see. So anyway, that's enough. That's all I have to say about that one.
Okay, that was excellent, and I agree. We all need everybody, and we enjoy being with one another, and there's value in everybody's gifts, and you've shared abundantly of yours. Carolyn, what would you like to wrap up with this evening before we let Dr. Holt go?
Just a big hug and squeeze for Dr. Holt, and what you're doing is awesome. We are just sort of giving people little breadcrumbs of what you do, and we really encourage people to get in touch with you to hear more and just have some interesting conversations with you. So it's TurnPointHealth.com, which is the website. So you can go to Dr. Holt's website and find out more about him and engage. That's what I have to say.
Very good. Very good. And everybody who does is well served. I can say that based on the feedback that we've gotten from a lot of our over the years. I mean, many years we've been working with Dr. Holt. So thank you so much for doing this with us. It was so much fun, and maybe you can come back again another time.
Okay, great. Thank you for receiving my broadcast from this healing tunnel, and we had a lot of fun today, so thanks again.
Excellent.
Okay.
Thank you so much. Thank you.
Take care, David.
All right, everybody.
Bye-bye.
Okay, bye-bye.
Bye-bye. We're going to have a break here, you guys, at the top of the hour, and we'll be back next hour with Dr. Dean and all the rest of the gang.
We'll be back with Hour 2 of Live with Dr. Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
AchieveRadio.com. What a beautiful day to be alive. My debt is paid and more money arrives. The fridge is full and there's plenty of ice for a fireside chat with anyone I like. What a beautiful day, good to be here, when almost everyone has disappeared. When almost everyone is waiting in line, it's good to meet you in this world of mine.
All right, everybody, welcome back. Hour 2 of Live with Dr. Carolyn Dean here on Achieve Radio. Thanks, everybody, for being with us in the first hour. And in this second hour, we are going to press on with our important schedule of all the things that we like to do on Mondays, including talking with Dr. Dean, learning about what blogs she's written and what things we're talking about and who said what about who. And so welcome back, Carolyn. Did you enjoy yourself?
Oh, yes, but it's a difficult format, and we said that at the beginning. It can take an hour to sort, to get to a certain level of intuition. I've learned how to just take the condition, okay, here's a sentence and matches, and cross my fingers, and sometimes people do have an insight from it. But if you're going to do deep work, you have to take the time. And as we said, it's a way of people getting to know the folks that we refer to. And
yep.
I think Dr. Holt, if people have a one-on-one, he has this almost hypnotic, sing-song way of talking that it can relax some people, but other people like Bob, he might find it irritating. So everybody's different in the way they would engage this type of information.
Very good. Yep, absolutely. Yeah, and everybody, I think, finds their own. Yeah, just as you said, Carolyn, perfect words. So what shall we press on with now, love?
Well, I do have the blogs to talk about. If there are phone calls, we can do those. I do have testimonials. There's a lot going on this month because it is Heart Month. The first blog, the latest blog is about the heart. Let me see if I can find it. Don't make it Heart Month, make it Magnesium Month. Yeah, make Heart Month Magnesium Month. And actually that got a lot of feedback, and it brought up my favorite Scottish, I think he's a cardiologist, Malcolm Kendrick. He's written The Great Cholesterol Con. Well, he's recently turned pro-magnesium. He read the most recent review on magnesium, and the review is called Subclinical Magnesium Deficiency, a principal driver of cardiovascular disease and a public health crisis. So this is a very important article that is starting to encourage these cardiologists to open their eyes to this problem of rampant magnesium deficiency. Someone sent me, and I have the date wrong here, the Life Extension magazine, December 2016, did an issue, Will Magnesium Be the Next Vitamin D? And, of course, I scream out, no, because taking too much vitamin D is what's harming a lot of our folks. So this is an important blog. It's at drcarolyndean.com, went up February 4th. And it would be good if you click on Dr. Kendrick's blog, go to it, What Causes Heart Disease. He's got hundreds of people, 225 replies to what he's saying, and it's quite interesting. Several people have mentioned, he's in the UK, several people are saying Dr. Carolyn Dean from America is a major advocate of magnesium. I learned a lot from Dr. Dean's book. There's like 3 or 4 comments here about my work.
Did you know Dr. Kendrick before?
Yeah, I read his The Great Cholesterol Con book, and I've written on him a couple of times because he he totally rips apart the whole cholesterol myth that cholesterol.
Right, I've heard you talk about that.
Right.
So this guy is now shifted to magnesium?
He hasn't shifted to it. He, a couple of blogs ago, he said, well, magnesium isn't that important. It's not that deficient. And then he read this new study, and he said, I was wrong.
Oh.
And that's awesome in itself to have someone say they were wrong. So it's pretty cool. So anyway, I want people to read my blog, go to his blog, and start making comments, because we know how important supplementation is. This information is not getting out there fast enough to help the people that we want to help. So,
would you want them to recommend Remag or just do the magnesium?
Of course.
Neem?
Of course.
Emphasize Remag.
Yeah, you have to, because otherwise you're just going to take a magnesium that causes a laxative effect, and they'll say, that didn't work. She was wrong. And, the people who criticize the Magnesium Miracle book, it's only because they say, well, she's just trying to sell her product. But, I've developed quite a thick skin about that, because we know over and over and over again that people tell us if they finally take Remag, they start to feel better, because the other magnesiums don't allow them to take enough. So that was the first blog, or I should say the latest blog. The other one I did since last month, seriously, ? Supplements do not prevent fractures, ? So that you've got this sort of half-truth study, 2017 Journal of the American Medical Association study, focused on calcium and vitamin D, and they found that supplements don't prevent fractures in healthy older adults. And, of course, it's very misleading, because bones do need nutrients, and they need, obviously, more than calcium and vitamin D. So the anti-nutrient lobby just sort of pushes this information, pushes this title to make people feel that, well, I guess nutrients don't help. And they get it all wrong, because they miss the fact that there are probably dozens of nutrients that are needed to make healthy, perfect bones. But they always leave out the magnesium aspect. So this is another very important article. If you know people who have osteoporosis and don't understand the importance of magnesium, this blog could help them. So those are the two main blogs, Ginny. What would you like to do from here? Go to the phones, the chat, or the mailbag?
Okay, let's put out a call on the phones, which is 602-666-6027. If you're on the line and you have a question or comment, we'll put you on the phone with Dr. Dean. You've got to hit *5 on your keypad, *5 to let me know you've got a question or comment, and then we will put you on the phone. And then also let me read some comments off the chat line, Carolyn. Going back to when Dr. Holt was on the phone, Jean typed in and said one of the things that what Dr. Holt didn't read in the email that she had sent him is that my 35-year-old niece really wanted a family. Within months of my consultation with Dr. Holt, she met a man she married the following year, and they became parents 10 months later. So again, to his point that, as you move things, people move around you move too. And then let's see, Kim types in, Carolyn, I am so very grateful for Dr. Dean's wisdom of offering me so long for information to the world. I've been taking Dr. Dean's products. I am so thankful. Years of being used and abused, and I realized physically I was drained, not concentrating on my emotions, which was so damaged and crushed. Just listening to the doctors, so awesome knowing that I can move on to another stage. I was everything to everyone. My head and neck were so laden with pain. Thanks to Remag for the pain rescue. Oh, that's Marv. Marv wrote that in. Thank you, dear. And then Allison typed in with Dr. Dean's formulas and Dr. Holt's insights. It's a big win-win. And let's see. I think that's the extent of the comments that relate to the show, Carolyn. So, and also Ronan typed in and asked, why is iodine important?
Why is iodine important?
Yes. Is iodine important enough that you should take it as a supplement?
Well, yes, Ronan. We have it in our Remite because it's very important. It's the main mineral in the thyroid hormone molecule. I'm looking it up right now. If you look up thyroid hormone molecule and you compel that up, the chemistry of thyroid hormones, and you see iodine just sitting right there, 4 iodines in the T4, 3 iodines in the T3 thyroid molecule, so it's absolutely crucially important. But what happens is people think, yeah, iodine's really important. Let's give a ton of it. And they give too much. And some people can take it and some people can't. And I always say just go low and slow with everything except magnesium because it's so safe and it's so deficient and it's so necessary. So iodine is very important for the thyroid. And then there's this whole thing with the peroxidase enzymes. The peroxidases, they chew things up. And some of them depend on iodine for their germ-chewing ability. The body depends on iodine to keep breasts from developing fibrocystic breast disease. There's treatment therapies. I think the high-dose iodine might have come out of that research where they started giving higher doses in women for the fibrocystic breast disease and then realized it was helping women with breast cancer. So it got turned into more of a medical therapeutic, and then everybody got a hold of it and said, well, if it can treat breast cancer, maybe it can prevent it. So a lot of people started taking high-dose iodine and then started to get thyroid problems. The few times we've had people who say, well, I can't take the Remite, I seem to react to iodine, it turns out that they were the people that took high-dose iodine therapy on the kind of advice and the fad that was around to take high-dose iodine. So there. Enough said.
Very good. All right. There you go, Ronan, from Dr. Dean's mouth. Okay. Excellent. Let's see. I don't think we have any callers, and if you are wanting to talk to Dr. Dean, you've got to hit *5 on your keypad. So that will let me know that you're here with the question or comment. Otherwise, we will press on with our important schedule of answering emails and talking about all kinds of other things. So no calls at this moment, Carolyn.
Okie doke. So regarding Health Month, here's a good testimonial. It's from a gentleman named Paul, and he starts with, lifesaver. I have always had heart palpitations starting at age 16, and as I got older, they proceeded to get worse. Now, who's the gentleman who had that same start of his story, heart palpitations age 16, and by 55 he was finally taking the completement formulas?
You mean our good? Yes.
Yeah.
You mean our friend who would call in all the time? Yeah. Okay. Yeah. Let's see. Oh gosh, I want to say. Ooh, okay, I'll come back to it. I know who you're talking about, though. Yes, he started very young.
Yeah, we the stories. Yeah. So Paul says I eventually went into Roman. Yeah, because Ronan threw me off because I knew it was like
it did too.
Yeah. So Roman had the same story, and I think people can go into our archives, can't they, Ginny, at drcarolyndeanlive.com and type in Roman and then find where his story came up in our archives. Is that true?
Yes, you absolutely can do that.
Yep. So Paul continues, I eventually went into full-blown atrial fibrillation with a heart rate of 240, cardioversion after cardioversion. Then it became ablation after ablation. Then the mother of all, a massive heart attack. I had 100% blocked widowmaker. That's one of the coronary arteries. That was September 2015. Why these doctors never looked into my plumbing, I will never understand. I passed away 2 times, and yes, there is an afterlife, a glorious afterlife. Fast forward to June 2016. I now have a pacemaker defibrillator implanted in my chest. I was on numerous heart, cholesterol, blood pressure, anxiety, blood thinner meds, and whatever else they thought I should have. I was still having terrible atrial flutter, PVCs, and every other heart rhythm problem known to man. I was at my wit's end. The doctor said, all I can do is increase your meds. I started real deep research on the web about my condition. Behold, I came across you, Dr. Dean, and your atrial fibrillation book. I read, I thought, I researched, I purchased Remag. Praise the Lord. Within 5 days, things started to get better. Now,
wow.
I'm going to stop here and say we are not treating any of these conditions. We are not treating disease. We are giving this person magnesium to treat a magnesium deficiency. That's what's happening here. When someone reacts that fast, this is a magnesium deficiency that he had. I mean, it'll be before 16 because you don't suddenly develop heart palpitations without having years of magnesium deficiency beforehand. Praise the Lord, within 5 days, things started to get better. Things have improved ever since. I am only on Repatha shots for high cholesterol and Sozolol for rhythm as a precaution, I think. I feel like a new man. Back to work doing anything I want. No more fear of when it is going to go nuts again. I still have some minor fluctuations in rhythm, but it is so great to be normal again. I'm spreading the word of this miracle supplement. Thank you, Dr. Dean. Thank you. So, and I said that when I responded by email to Paul, and I said, yeah, it sounds like you always had magnesium deficiency, and you finally treated it with Remag. And I told him about maybe he could look at our other products, not just look at using Remag as a medicinal for his symptoms, but look at the other products to tidy everything else up and give the structure and function of his body a little more support, because that's what we're doing. We're treating the structure and function of the body so it'll work better. And this goes on every day of every minute, every year, where doctors who weren't as fortunate as me, I was interested in nutrition before I went into medical school. I did my naturopathic training after med school, and I incorporated both. And every doctor could do that if they got a little encouragement. But instead, we have the FDA who just supports the drug approach to health and wellness and ends up just making us more diseased. I'm sorry, but that's what's happening. I have another testimonial. Are you ready for that one, Ginny?
Yeah, we can do that, and then we're going to take a phone call, I think.
This is a long one, so let's go to.
Okay.
Yeah, let's go to the phone. Yeah.
Okay, very good. Area code 641. 641, you're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hi, this is Anita from Iowa again.
Hi, Anita.
Hi. I have a question for you. I'm still plugging along with my own stuff, but I'm recommending the Remag to quite a few people that I know, clients and people I know. And the question is coming up, we've talked about, the taste thing. So my question is, how important is it that it's diluted into the water versus taking it, say, in just a small amount of water, like a half cup or a cup of water, medicinally versus diluted into the water for people that are just really adamant, I can't take this. Right. They're willing to take it as a dose of medicine.
Yeah,
but they're not.
I get it. I mean, we've had to deal with this question all the time, Anita. You can imagine. What happened is we get so many complex, toxic, drugged up people that maybe in 5% of people, when they start taking Remag and dose it like a whole teaspoon at a time, it can rev them up or detox them too fast. So as a blanket recommendation, we said, look, dilute it, sip it, go slow. Because when you're dealing with a product and you have to put something on your label to tell people what to do, and we decided to protect as many people as possible, we'd ask them to sip it through the day. But I'd say the majority of people could take their half teaspoon 3 times a day. I take a half teaspoon twice a day. And based on a recommendation last week from one of our callers, who was it, Joan, she puts her dose in with some organic lemon juice. And I said, oh, my gosh, I obviously knew I could do that. But I've started with my 4 ounces of water, half a teaspoon of Remag, half a teaspoon of lemon juice concentrate, stirred up. I do not taste the Remag at all.
Mm-hmm. I don't personally have a problem with it at all because I'm doing 4 teaspoons in a half a gallon over the day, and I don't taste it. But, I'm trying to get my own husband on it, and it's like he said, well, I'll just as soon take it in I tried to put it in his tea. I can still taste it. Everything I put it in, I can still taste it. So I'm confused, but I just wondered if I just gave him.
Try the lemon juice, or like you say, just in a couple ounces, knock it back, and then drink some more water, and the taste goes away very quickly.
Yeah.
So you can do what you want.
I just wondered, does it make it work any less effectively? Would you say?
What I was just going to say is when you take a whole teaspoon at once or even more at once, you can overload your cells and waste some of it. Okay. It'll come out your urine, so you could be wasting it, and that was another reason and why we said to sip it through the day. But I think a half a teaspoon several times a day is probably a way not to waste it, in a way that you can just take it quickly and not have to be tasting the bitter taste all day. Okay?
Because most of the people are willing to drink water, drink their water, half their body weight, but they just don't want to have that taste in the water.
Right. Yeah, and if you put the sea salt in the water, I mean, Jenny tells me that she loves the taste of a Remag and Remite in the sea salted water. So everybody has different taste buds, and you just sort of sort out for yourself what feels best to you. But bottom line is, whatever you do, just keep taking your minerals. That's the most important thing.
Mm-hmm. Now, is it okay to take those like all at once in a drink in the morning? The Remite?
Take what?
Remite.
Remite is it seems to be a bit different. I usually just take mine as 1 dose a day. So what do you say, Ginny? Have people commented on taking Remite, like sipping or 1 dose or 2 doses?
Well, people who use the Remag just throw the Remite in. Remite is not nearly as difficult to deal with the taste. It's very mild compared to the Remag. Remag is the real challenge because of the concentration. So, yeah, you can do Remag twice a day. Same kind of thing. Add it to your water. Sip it slowly if at all possible. Put it in with your Remag water. And they're both very compatible with transdermal.
Okay, that's really interesting because the Remite is what I taste as being very, very bitter.
Is it the iodine that you taste, or I taste the iodine?
It's something really, really bitter, really, whenever I've tried to take, like, concentrated minerals of any kind, it's usually that kind of, so that I put in lemon water in the morning and take all at once. But the Remag doesn't faze me at all. It tastes sweet. My water just tastes pleasant. It doesn't faze me.
Right.
So I think it's interesting.
Anything else, Anita?
No, just I'm plugging away with my own heart stuff, and it's not perfect, but it didn't happen in 5 days for me, so.
Yeah, I know. Patience is, I wish I had a remedy for patience, because that's what everybody needs, is just to know you're on the right path and just be patient, and it will come.
Thank you. Yep. Mm-hmm. Thank you.
Anita, thanks for calling. Bye-bye.
Bye.
Okay, excellent. 602-666-6027 to call is the number if you want to talk to Dr. Dean, and you've got to hit *5 on the keypad and let us know that you're on the line. So right now our calls are clear, Carolyn. We can keep pressing on.
Okay, let me go to, now this is a really good testimonial. It's from a long-time customer. Good morning, ladies. I had my 6-month checkup this morning, making progress with cardiologists regarding reducing or not taking the medication he prescribes. Now, the FDA doesn't like us doing this, doesn't like us taking people off meds, but we aren't. What we're doing is making sure people's structure and function is working properly, and then when it's working properly, who needs meds? I mean, it's just obvious. This is what I learned in medical school. First, do no harm. She says, I talked to him about working with nutrition and supplements to make progress on issues he feels only medication will take care of. He said, if I get my annual blood test from my bariatric doctor and use them as a baseline and get the tests again in 6 months as a comparison, he's willing to approve reduction or ceasing some of the medications. He still isn't happy that I won't take the cholesterol meds, but he can't argue with my blood tests, which show no cholesterol issues. So I'm good for the next 6 months and have made progress to get off the rest of the meds. It certainly would be easier if the hospital system where the cardiologist works and the insurer didn't watch every move I make and send me emails and phone me every week to question whether I'm compliant. When I got home today, there were 15 emails from the hospital system reminding me of what they want me to do in 2018 as far as tests, medication, elder warnings, etc. The latest scam is they want to come into my home to evaluate it for elderly hazards so that an old person like me can manage. This is, I'd say too, she said. I was quite insulted to be lumped in with all the folk who are waiting to die now that they are over 65. And of course I would never allow them into my home so that they can do more information gathering. Well, progress is progress. Last year the cardiologist agreed I could do Blue Ice Royal on my own dime instead of 50,000 IUs of vitamin D capsules once a week. This year I'm hoping to get him to quit harping about cholesterol and reduce or eliminate the blood pressure meds. Again, thanks for your help and support. So I said it's just bizarre the way they keep flogging the statins, even though your cholesterol is okay. And I continued, and it's because statins are the only thing they believe can prevent heart disease, but they're wrong. And I told her I'll probably work up some of your words into a blog soon and talk about Dr. Malcolm Kendrick's The Cholesterol Con. And I mentioned to her he's come out in support of magnesium for heart disease. So, I mean, that's what I know a lot of our customers are facing. I think Jean talked about that in the early stages, where if you're on some sort of disability or insurance and you're not compliant with your meds, they'll just stop your insurance or stop your disability. They insist that their way or the highway, and that's terribly abusive. So there's that. I could go on, Ginny, unless you have some phone or chat for me.
I don't think everybody is chatting among themselves, it looks like, and so I think we're good.
Okay, good. So I'm just playing with my notes here, and here's an interesting. This came from Naomi over in the UK, our wonderful distributor in the UK. If you want to know where to get our products in Europe, you can get in touch with customer support at rnareset.com. So she thanks me for the blog Make Heart Month, Magnesium Month. And she said, I see you recommend the fermented cod liver oil. She said she knows about it from the Weston A. Price lectures, but she says, I'm slightly concerned and unsure about the benefits of fish oil. It's a tricky one. She said, I spoke with my sister who thinks that cod liver oil in low dose is probably okay. Dr. Ray Peat thinks fish oils are dangerous. Recently, we had a news report that actually came out with exactly what Dr. Peat has been saying, that they're bad for the liver. I'd be interested to hear your thoughts. As children, we always had a teaspoon after dinner. So, I grew up on cod liver oil as well. So I said to Naomi, I agree with your sister, and that's the reason why I only recommend Blue Ice Royal. It's a low-potency food-grade vitamin D, A, K2. Being fermented makes it digestible. And someone asked me, well, if it's fermented, is it going to affect my yeast? And no, I mean, it's a small amount of this cod liver oil, and it would be like sauerkraut or kefir or yogurt. It's a naturally fermented food that in ancient times or in early days, they ferment food to keep it safe. It was a way of preserving food. So the fermentation, I do not think Blue Ice Royal fermentation is going to affect yeast at all. It's probably going to be beneficial. And I continue to Naomi. I don't like the high-dose fish oils either. The studies they do on the fish oils, they use processed fish oils. They use very high doses. They treat them like drugs because they have to perform in a 6 to 8 week window so they can make their claims. Nutrients, on the other hand, are foods that you eat regularly as building blocks for proper structure and function of the body. They're not drugs. And I think that's important. I've never put down fish oils before, but I suppose some of these articles are coming out now. But at the same time, you can find a pro article and a con article about anything, or a pro study and an anti-study. You really can find both sides of the picture. And you're left with that. It's like cancel. The two bits of information cancel themselves out. So you have to use your common sense. Why use a highly processed fish oil when you can just do some fermented cod liver oil and butter oil and get low potency vitamin A, D, K2. So that's my thinking. In spite of all the studies that say, thousands of milligrams of fish oil and you get all these benefits, but when they do studies, they use one thing. They just use the fish oils, and they say, less people died. But we're not living that life. We're living a life using our Remag and our Remite and our Realign and taking our Blue Ice Royal, and we're taking a little bit of all the perfect things to take. And that full synchrony of what we're doing is what's making our body just feel so awesome. We are not pushing any one thing except high-dose magnesium. So we're just covering all the bases in a very common sense, basic fashion. Right, Ginny?
Excellent. That's exactly correct. And also making Dr. Dean available to answer questions. And we've got some callers, Carolyn, that want to talk to you. So can we do that?
Yes, absolutely.
Okay. Excellent. And we're going to be going to one of our longtime good standing friends. I haven't heard from her for a while. I'm so glad she's called in. Good evening, Sandy.
Hi, how are you doing? You know what? I do have one little question, but I'm actually calling because I want to tell you it was a year and 8 months ago that you reached out and pulled me out of a terrible place. I was from having amoxicillin, and I was even having seizures at the time. Not only am I doing I'm living pain-free days now, but prior to taking that medicine and that happening, for about, I would say 30 years, they went back and forth saying I had fibromyalgia, and then they didn't. And I took myself off Elavil a long time ago, and for 10 years I was going to that chiropractor like twice, 3, 4 times I bought him a boat. So at any rate, what I want to say is, do you know that after a year and 8 months, not only am I almost 100% better from the medicine, I have a problem at night, no problem, it'll get better, but the fibromyalgia I experienced before, I was always going to him for back pain, neck pain. It doesn't happen anymore. I'm not experiencing that anymore.
Wow, that's amazing.
I think
that is so fantastic.
I think all those years they weren't diagnosing it right, and I bet you 10 to 1 what it was a mineral deficiency. I also, the guy that you had on, and he's talking about how emotions being attached to all of these things like fibromyalgia, displaced pain syndrome. So what I wanted to say is if it wasn't for the magnesium protocol, I don't think we would have been able to calm down my mind enough, because I did that. I did the thing. I peeled all the onions. Everything's gone. I'm doing great. And I don't think I would have been able to do it and have the result I did without the magnesium, because I think the magnesium calmed my mind down.
I see. So, but the magnesium took away the physical body irritability and physical anxiety, and you were able to work through the emotional layers.
Yep, because you were right when you said it's too much to go through all that pain every single day for that long by the time you met me, and I should go and seek help. So I did. And I don't think it would have worked. But as I did it, lo and behold, I don't have fibroid. I don't even know. They kept saying it's fibromyalgia, then they didn't. But it was ongoing, a chronic pain, which is because of the horrible medicine that I took. Actually, it might have been a blessing because it fixed so many. I'm doing so much better. Also, being on the protocol for a year and 8 months, I have less floaters in my eyes. I used to have floaters. I don't have the floaters. Even the floaters are less. The only thing I'm really missing your cream. Can't wait till you get the cream back. I do have one question. What do you think about spirulina, I think they call it, blue-green algae? It's supposed to help ward off the flu, and I'm in Connecticut, and and I don't want to get sick again. So I did get some spirulina, but I do know it could be hard on the liver. So what do you? And I've read that it can help ward off viruses. What do you think of that?
Well, the thing is, Sandy, they could say that about dozens of things. I just, we recommend the silver products, natural immunogenic silver, I don't know about spirulina. I don't know where it's grown. I don't know. I'm not saying that they're all contaminated, but we don't know where this stuff is grown anymore. When spirulina first came on the market, some reputable companies had it. Now everybody's making it. So I have a hard time trusting things anymore. But when I find a good mineral product that will do the job, then I go for the minerals. I think that's become my philosophy.
Now, if you were going to use the silver, because the flu is so prominent in Connecticut, and you're going to go out and you're going to be in the world and come home, so are you suggesting that when you get home, rinse your mouth out or your nasal, a little bit on the nasal, or you think actually take a teaspoon of silver? I have the silver. I know what you're talking about. I bought it when I got that time.
Yeah, I would take in flu season personally. I don't have to because nobody gets sick in Hawaii. But I would take a dose a day during flu season. But also remember my nasal rinsing. You put a little sesame oil in the nasal cavity. That'll protect it. You do a little oil pulling. Those are the modules that I have in my online wellness program, and I think those.
And I've been doing that, so I know about that. But you're thinking with the silver, it's perfectly okay to, if you're going to be to take that teaspoon of silver, even though you're not sick at that time, that you just want that little.
Right. I think you can use it as a preventive. I would not use it every day of the year. But during flu season, you can do that. What I do when I go on a plane is I'll take a dose of the homeopathic called oscillococcinum.
Yes, I have that too.
Oscillo, O-S-I-L-L-O. And what you're doing, I mean, maybe it's a bit of placebo, but that's fine too. You're taking action and saying to your body, look, I'm protecting you. Just don't worry. And that's it. I'm sure that's how, if some people are helped with flu vaccines, I'm sure it's a placebo because it sure isn't, working any other way. So
well, you're hearing about tweaking up the because of this very bad flu. They're going to make the tweaks, and next year it'll be in that flu vaccine. And they're really, and I don't know, I haven't been taking the vaccine. Do you think that's more hype towards it that is unnecessary?
Of course, Sandy. You're coming out of years of suffering, and now you're looking around, and you have to watch that you don't get brainwashed. You've said 4 times now in our short conversation, the flu is bad, the flu is bad. Everybody listening has, oh my gosh, I'm going to get the flu. I don't even want to talk about it. I want
you're absolutely right. You're absolutely right. Huh.
You're healthy, you're happy, you're taking the formulas. That's what you.
Oh, I got it.
You want.
Yeah, the protein powder is fantastic. I ran out a little bit of that RNA. I put the water in it, like you said, distilled water, shook it up, and then this morning I thought, well, instead of taking 3 drops, I'll take the 8 drops because it's got water in it now. It really, oh my God, you should have seen me running. Singing and happy. I'm telling those RNA drops are incredible. I think they're a big thing for just boosting the body's immunity. To make you feel all that energy and happiness. I'm actually happier when I take the RNA drops. I'm actually feeling more energy. Yeah, they're incredible.
So watch yourself, Sandy. Don't get pulled into any of this hype. They are just trying to sell vaccines and sell drugs and make us all less than so we can be controlled. Do not fall victim to any of that, okay?
Oh, I definitely won't. I'll let someone else get on with you. Again, thank you to you and Jenny. And I am doing, I know you must remember how bad I was, and to see me today, I can't begin to tell you what it's like to live pain-free days. Incredible. It's incredible. So,
thank you, Sandy. Thank you.
Because really, you're godsend. You have a wonderful day over there in Hawaii, and you guys just have everything great. My granddaughter actually is in Hawaii. It's such beautiful there, she says. So enjoy. Yeah. Okay, great to you, and best to you both. Thank you again. Bye-bye.
Bye.
Excellent. Wonderful. Very good to hear from Sandy. Haven't heard from her for a while, and she's such a joy and truly just an amazing experience that she's had. Wonderful. Okay, Carolyn, we're back 11 minutes to the top of the hour. What shall we do next?
Here's something that came through. It's a little more esoteric. Someone is saying to Bob and I, she says, you and Bob are so generous to share all your recordings with ION along with the medical ones. I've told you so many times already, but they are all amazing, and I so appreciate all of them. If I could hug you both, you would probably end up with rib fractures. I had an urge to check my blood pressure since I've not had a physical in a few years. I've always been healthy, but the last 2 years have been a huge stress on my psyche, having to work 3 days a week at a local newspaper. And she's saying the politics since President Trump has gotten in have been very difficult for her. So major, major stress. And she said with all this, her blood pressure was 200 over 108. Now, that's huge. And she said she was a little freaked out. She's going to do some yoga, try to calm down, check it again when she's less agitated. She does take magnesium and RNA drops. Maybe she says maybe I should take more, so I answered her back. And I said, just like Sandy said to us a minute ago, I said, yes, more RNA drops for blissful detachment and more Remag for sure. You can also take Rescue Remedy or look at the Bach flower remedies for fear, because she says the stress at her job is just paralyzing her. And you can Google this, the Bach, B-A-C-H, flower remedies. They have Mimulus for fear of anything you can name, Aspen for fear of the unknown, Red Chestnut is fear that something bad is going to happen to your loved ones, Rock Rose for frozen terror, Cherry Plum for fear that you may lose control, Elm for feeling overwhelmed, White Chestnut for repeated unwanted thoughts or worries. And I also told her, remember what I say, being angry at someone or something is like you taking poison and expecting the other guy to die. And you don't have to make yourself sick to show that you care. I told her to come on the show with Dr. Holt and see what he'd say. But this is very important information for people to know that they can be the cause of their own symptomatology, just the stress that they undergo. And then because we're always told when we go to the doctor, oh, well, this is a physical problem and here, take a drug, we begin to think, well, I have a physical problem and I need a drug and I don't have any control. Whereas what people are doing is creating their own tension and stress. And what I wanted to mention here, there's a book that came to me, one of our customers, and let me get the name of it for you. She had me read it, and I don't know, she might have put my name in it, I don't know, it doesn't matter, but the name of the book, I have it in my Kindle, is Quiet Thoughts, Calm Mind, the Natural Way. And the author's name is Mercedes Trost. Mercedes, T-R-O-S-T. And what I like about it, I talk about EFT because my sister does it. What Mercedes has done is put in breath work, put in mindfulness exercises, gratitude exercises, autogenic relaxation training, meditation, emotional freedom technique, and it helps you integrate these 6 or 7 modalities so that a person can look through this and think, I'll do some breath work, I'll do some walking meditation, I'll do mindfulness. It's a wonderful book. It's just a great resource, even just as a reminder that these things are under your control. And it doesn't have to be a drug that you reach for. You can reach for this book, Quiet Thoughts, Calm Mind, The Natural Way. And if I recall, Mercedes wanted to send me the physical book, but I just read Kindle now. So I get it on Kindle, and with my Prime on Amazon, it's free on Kindle. So I think that would be wonderful for this last customer who wrote me about this massive stress that she's under. So there. What now?
So there. Very good. Now, I do have a question is, how do you know, because we get a lot of questions about the flu through customer service, and of course people are, they're not going to take that vaccine, but then, when they hear what's going on in their communities, they start to freak out and think, what can they do? And we talked about the Sovereign Silver, and you do have the show that you did on the flu, but one thing somebody asked me, which I thought was a good question, is how do I know if it's an emergency and I have to go to the hospital?
I know. It's like we're so far away from any first aid or any knowledge about our bodies. What do I say? If you're vomiting and you can't stop, if your head is splitting with such pain, if you become so dehydrated and you can't drink, if you've stopped urinating, if you have 104 fever. I would think these things are obvious, but what you do when you get a flu or a cold is stop eating. Just drink your sea salted water, put some lemon in it, chicken broth at most. Stop feeding the flu. Stop feeding the cold. Dairy products will give you more mucus, for example. It's all in, I know in customer service you're giving people my flu and cold remedy section, just cutting and pasting that and sending it to people. And I've blogged it many times. Just Google my name and flu and cold, and all the different things will come up. In the cold weather, you wear a hat. Even around the house, wear a hat. Stay home from work. Real obvious things, because flus are viruses. That's why they try to do the vaccines, because they know antibiotics won't work, but people will insist on getting antibiotics, which I think just distracts your body from taking care of itself, because it has to detoxify this drug. It's just incredible. And what happens, this next story happens, someone wrote me about fluoroquinolones and their toxicity, and saying that 4 years ago I took fluoroquinolone for a sinus infection. They wrecked my health. I'm fortunate I did not end up, like some people do, confined to a wheelchair. Nonetheless, even a mild case can be quite devastating. The damaging effects of fluoroquinolones are caused by their chemically bonded fluorine. This I'm quite certain. One study showed that children given Cipro had increased levels of fluoride in their urine. She said, I tried Remag years ago for my toxicity, but ended up coming off after no results. It did work better when you use, I wrote to her, I said, it does work better when you use all the complete formulas. But she continued and said, I ended up experimenting with boron and other fluoride detoxifiers. Finally, this year, I started taking Remag again. I've just emerged past the zenith of the most intense detox I've ever experienced. She said I could feel the fluoride imploding or exploding in my body. and she said that I know the REMAG is healing the fluoride damage. My sinus function, which was very bad, has improved. A certain male organ, which has not functioned properly for 4 years, has started working again. Words cannot describe how I feel about this. After years of chronic fatigue, he said, I think a large part of me had given up. I'm, of course, insanely thankful for what now seems self-evident. I'm healing.
Mm.
And I'm wondering perhaps if you could give me any input how I might proceed with the REMAG, trying to keep the detox going slowly. So I did say, he's only, he's on 2.5 teaspoons of REMAG, only 3/4 teaspoon of Remite, etc. So I just said, go on all the complement formulas. That's where we are getting the best results, is where people can just saturate themselves with everything, and it seems to provide the body with the right building blocks, and also do the yeast detox as part of the protocol, because it started with taking an antibiotic. So it means the intestinal flora really got bungled up. So he ends by saying, thank you for, I end up in capitals, said, thank you for sticking with REMAG this time. So,
no,
that's what we hear from people, even with something as serious. I tried REMAG. It didn't work. I don't know how long you used it, but people will do that to us. I tried it for 1 bottle, and it didn't cure me. So
yeah, I know.
Yeah,
I know.
and
I get so frosted about that. Oh.
Yeah. Oops. Thank you, Jenny. Thank you, everybody. Thank you, Bob and Bill.
Thank you, everybody. Great show. Thank you,
Jenny.
Awesome. Thank you, Bob.
I'm calling you, Jenny.
Later.
I'll be calling you right after the show.
Okay, sweetheart. Thank you.
Bye. Thank you.
AchieveRadio.com. Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
What if we got rewarded for every good decision?
Dinner.